who treats male pelvic floor dysfunction is the subject of this video, so stay tuned. Hi, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. The treatment of pelvic floor dysfunction doesn't matter on the gender, really. It depends on a lot of different factors. The number one failure in proper treatment has to do with the clinician and the patient. A lot of times, especially when it comes to male patients, they don't necessarily pursue anything unless it involves the penis or testicles. So by the time it gets there, unless that's the first line of issues, chances are that this individual has been working out incorrectly, has been sitting down a lot, has been having history of chronic back pain, chronic sacroiliac joint pain. This is your sacroiliac down here on both sides. Chronic hip mobility issues that, it's not causing pain, so it gets pushed to the side. So those are existing. So once they go in, let's say they have back pain or sacroiliac joint pain, and they go see a chiropractor or they see their doctor, their primary care doctor, get a referral to a physical therapist office, and they do the generic work on the lower back pain. No clinician is actually connecting the dots and trying to see, well, does this other thing exist? Does this other thing exist? Which are all symptoms of pelvic floor dysfunction. So when that is not happening, it's much easier to have issues with chronic problems. So who is the right provider to go seek? The right provider is the one that looks at you as in a whole, like your health is holistically approached. So that means your lifestyle is taken into consideration, your ergonomics is, your sleeping habits, your nutrition, your workout, all those symptoms. A lot of times patients come to my own office and I say, do you have, what can I help you with? And they start, in their mind, they start filtering the symptoms that they have and which one relates to my licensure or my type of clinic. And I remind them that I want to hear the whole thing, and for them to allow me to put the pieces together to see if these are different chapters of the same book. So start asking around, start reading the reviews of the different doctors. And just because a doctor has a better reputation does not mean that that's the right provider either. So this comes from someone with a lot of Google reviews. I have a lot of great 5-star Google reviews, but I'm telling you that read those reviews to make sure that this is the right fit for you. Contact the office, talk to the person that answers the phone, ask the questions. In my office, for example, I have the opportunity for every potential patient to come in for a 20-30 minute of conversation with me. I want to make sure that their problem is something I can help them with and that there is a match. Because if, for example, in my practice from this end of the spectrum, I want to make sure the patient understands that they need to be active participants in their own treatment. And in reality, I want them to learn what they need to do going forward so they stop seeking care unless it absolutely is necessary. Of course, not everyone has the expertise, but the guesses become more educated guesses. And that to me as a provider is important. So this is a time to really get to know the provider a little bit more and make sure that you understand what it takes to get you on the right track. So do a little bit of research, do a little bit of further investigation, talking to the provider or the staff and asking the right questions. If the provider has a problem with you asking questions, that is not the right provider. Because at the end of the day, I think a good provider is the one that provides enough information for the patients to recognize how to foresee a future problem and how to tackle a problem in a timely manner. So I hope that this answers this very, very important question. And if you have any other questions, use one of the methods of contact in the description box to contact my office. And thanks for subscribing to the channel. Take care.